It's coming.
Hi, I'm Tobias Naegele, Editor-in-Chief at Air and Space Forces Magazine. We're here at AFA's 2025 Airspace and Cyber Conference, and I'm talking to Veterans Healthcare and Taylor Miller. So Taylor, Veterans Healthcare and Airspace Cyber, what are you doing here?
Yeah, well, thanks for having us here. We're here, our sole purpose is to help veterans, veterans and retirees alike with their Medicare decisions. We've been in business now for about 5 years, and we found that the Medicare space is very confusing. And then you add in veterans and retirees, those who have Tricare for Life, VA coverage, CHAMP VA, and it gets a lot more confusing. Our industry's done a really bad job at helping these individuals. So about 5 years ago, we got together and we saw an opportunity to help veterans and educate them in their benefits and what they have. There's a lot of old information or bad information, and we're here to fix that and to help veterans with their Medicare benefit.
So this is it's a secondary insurance.
Yeah.
What is special about a veteran, and what's special about somebody who's covered under Tricare for Life?
Okay, so a veteran that has Medicare, Medicare's the foundation. It's the primary coverage. Yep, usually 65 or older. We do help people under 65 who are 100% disabled. But Medicare's the foundation. Then from there, you have Tricare for Life, and Tricare is a wraparound coverage that helps pick up extra co-payments and other things. But Medicare, it's the government. They do a good job providing benefits, but they work with private insurance carriers who are able to maximize those dollars. So if you were to sign up on a Medicare Advantage plan with a private insurance company, you're still covered for all of your Medicare benefits, but now they're able to give you things like dental, hearing, vision, a Part B Medicare reimbursement where they're able to put money back into your pockets, all this at no additional cost. So there's a lot of extra benefits that veterans and retirees have available to them that they're not currently accessing.
And in general, if you're retired, you're a veteran, you go to a standard health insurer, they're not really going to have the detailed understanding of those nuances.
Yeah, no, like I said, it's confusing even for the carriers. This is where we come in. This is all we do. Our sole purpose is to help veterans who have Medicare. We know the ins and outs of Tricare for Life and VA and CHAMP VA. We are the experts in this. Most of the industry, this would be over their heads. It would be too confusing for them. We really found a niche in a certain demographic of people who needs a lot of help, and we dove in. And this is all we do at helping veterans with their Medicare decisions.
So when somebody calls and says, I have a problem or I have a concern, and they start talking about VA coverage and a private doctor, and maybe they've been to a military hospital because they're Tricare for Life, or they've gotten prescription. These things that would otherwise confuse somebody, say, oh, yeah, that's no problem.
No, not a problem at all.
A seamless experience. And
yeah.
A familiar voice on the other end of the line.
Yeah, we can help put all the pieces together. There's a lot of different benefits, and we're talking a veteran and maybe a veteran that's also a retiree. There's a lot of different pieces to put together, and we oftentimes are able to educate those individuals in how to properly put those pieces together to maximize their benefits. One common misconception is, if I have Tricare for Life, is this a good fit for me? Yes, it is. This will not disrupt your Tricare for Life. It's only going to enhance your current benefits. So those retirees with Tricare for Life, with CHAMP VA coverage as well, that acts as a wraparound, this is a great fit for those retirees and individuals, and we're only going to enhance what they already have.
And in some cases, you can actually buy the wrong coverage.
For sure.
Right?
Yeah.
And what happens if you do?
Yeah, you can definitely get the wrong plans. There's lots of different Medicare Advantage plans that you can buy or that you can sign up for, and there's only certain ones that are made for the veteran. There's a certain type of plan that's made for the veteran. There's a certain type of plan that's made for the veteran that's a retiree as well, that has Tricare for Life. They're two separate individuals, and we got to treat them that way. Otherwise, we could cause some damage. But once again, that's where we come in as the experts. We're going to make sure we only enhance their coverage and not hurt it in any way.
Okay, so Taylor Miller, CEO, Veterans Healthcare, thanks so much for being here, and thanks for explaining what you do.
Thank you very much. Thanks for having us.